Good afternoon, everyone. Thank you for joining us for Effects of Pediatric Chronic Health Conditions on Families, Protective Factors to Restore Caregiver Work Stability. We're looking forward to a great session. Please welcome Kate Chappell, Associate Professor at USC College of Nursing and Co-Program Director at Childcare Ready for All and Baby Coach. Dana Martin, Research Assistant at Childcare Ready for All and Baby Coach, and Victoria Davis, Professor at USC College of Nursing and Co-Program Director at Childcare Ready for All and Baby Coach.
Thank you so much for that introduction. Everybody hear me okay? Okay, great. Well, we are going to get started today talking about our presentation. So first, we're going to go over our objectives. So today, we're going to discuss the effect of caring for children with significant healthcare needs on family stability, including finances and employment, and identify protective factors and strategies to help restore stability, including strategies that use policy, practice, and research to provide equitable access and resources for families with children with significant healthcare needs. So we have no disclosures to report, but we do currently have funding through South Carolina DSS for the Preschool Development Birth Through 5 grant, and this funding helps support a newly created, no-cost, statewide program, CRAWL, or Childcare Ready for All, which is a training program supported by nurses to prepare early child care providers to be confident and competent in caring for children with significant healthcare needs while in a child care setting. So you can see our partners, including the University of South Carolina College of Nursing, College of Education, the South Carolina Child Care Inclusion Collaborative, and South Carolina DSS. So why is the topic of pediatric chronic health conditions on families so significant? Well, the CDC reports that approximately 20% of children in the United States have significant healthcare needs, including cerebral palsy, diabetes, and cystic fibrosis. So these children may experience exacerbations of their conditions, which then often requires consistent care on behalf of the family. So due to the increased care requirements of the child's condition and during any exacerbations that child may experience, parents and caregivers may experience work-life stressors, including difficulty meeting job demands, paying for medical care, and/or securing parenting support. Work-life stressors often negatively impact families financially, which can then lead to difficulty paying for health care, securing additional parental or caregiver support, or remaining in a suboptimal job in order for them to keep their health care benefits. So the purpose of our study was to analyze the relationships between the presence of chronic health conditions of a child in the home with caregiver work status and household financial stability.
These factors reasonably affect the family structure and stability. We frame this within the Strengthening Families approach, which many of you are probably familiar with. The Strengthening Families framework builds 5 protective factors at family or community levels: parental resilience, social connections, concrete support in times of need, knowledge, and social and emotional competence of children. Addressing protective factors through a Strengthening Families approach has been shown to increase family stability, enhance child development, and reduce child maltreatment in families. Identifying how financial stability for a specific set of families is affected can lead to targeted strategies to help support protective factors in a meaningful way. For this analysis, we used data from the 2019 U.S. National Survey of Children's Health. This survey is conducted through online and mailed questionnaires, in this case from June 2019 to January 2020. Anyone want to hazard a guess why we're not using the data from 21 or 22? Right. So we did want to get this initial baseline data without those additional factors playing in. So the household surveyed from the NSCH had at least one child aged birth to 17, and the caregiver who answered the questionnaire had to have knowledge about the health and healthcare needs of the child, as well as being a U.S. resident and ability to communicate in English or Spanish. We analyzed the relationships between chronic pediatric health conditions and caregiver or parent work stressors. We used a cross-sectional design. We had a sample size of 29,433 caregivers. This is a national data set. For each household recruited, one child was identified as the sample child to prevent clustering data within a sample and oversampling a specific family. Logistic regression was used to analyze 13 health conditions and 4 work-life stressors. Now Dana will talk about the health condition and work-life stressor variables utilized, as well as the results.
So the specific health conditions that we analyzed, you'll see up on the screen, were allergies, asthma, diabetes, epilepsy and seizures, heart condition, blood disorder, cystic fibrosis, cerebral palsy, Tourette syndrome, swallowing difficulty, Down syndrome, and then whether the child currently had behavior problems or had ever had behavior problems. We analyzed that with the work-life stressors that you see up here. So whether the caregiver or parent had to stop working within the past 12 months due to the child's health conditions, difficulty paying for medical care, avoiding changing jobs in the past 12 months to maintain health insurance coverage, and then cutting hours at work in the past 12 months due to the child's condition. Okay, and these are our results. So 9 health conditions that you see highlighted there were found to be statistically significantly predictive of stopping work in the past 12 months due to the child's health conditions. Some of the reasons for this finding could be that the health conditions and exacerbations are associated with missed school days, so the parent or caregiver may have had to quit work to care for the child, or the child's condition may require multiple appointments, surgeries, and or hospitalizations, requiring the parent or caregiver to stop working. Next. There were, here you see highlighted, the 7 health conditions that were statistically significantly predictive of difficulty paying for medical care. Possible reasons for that would be diagnosis, treatment, and transitional care for these health conditions are expensive. And even with insurance, co-pays, deductibles, and out-of-pocket expenses may be high. Next. So there were 6 health conditions that were statistically significantly predictive of avoidance of changing jobs in the past 12 months due to the child's health condition. Possible reasons for that were that the parent or caregiver did not want to leave the job in order to maintain that health insurance coverage. They may not have been able to afford an interruption in health insurance, or the fear of the possible need for treatment or hospitalization during the time without insurance if they were to change jobs. I skipped one, sorry. Last one. There were 9 health conditions that were statistically significantly predictive of cutting hours in the past 12 months due to the child's health condition. And the reasons for that were very similar to stopping work. So again, the health conditions or exacerbations could mean missed days of school, so the parent had to cut back hours, or the multiple appointments, surgeries, or hospitalizations would mean that the parent or caregiver had to work less hours. Okay. Yeah.
So this fun graphic represents the overlapping and pervasive nature of work-life stressors encountered by families with children with healthcare needs. So you can see that the 4 work-life stressors run along the bottom. So stopping work due to the health condition within the past 12 months, difficulty paying healthcare costs, being stuck in that job because they must retain those specific benefits, or cutting hours. due to the child's health condition. The count along the left shows how many of the conditions in the analysis had a statistically significant relationship that helped predict that increased likelihood of each of the work-life stressors. So basically, we wanted to bring those last four tables together to sort of show how cumulative and how certain diagnoses really run a color thread all the way across all four of those factors. So as you can see, all four of the factors were significantly affected by at least 6 of the conditions, and there were 2, the stopping of work and the cutting of hours. So those 2 are absolutely right at the pocketbook, right? Stopping work, cutting hours, that were more likely in the face of 8 of the conditions in our analysis. So for example, here at the bottom in the deep blue, you can see that allergies was significantly predictive of difficulty paying for health care and for caregivers needing to cut hours of work due to the child's condition. While when you look at the dark green thread that runs across the top, that's for behavior problems. And I do want to qualify this and say we stuck with the wording that they used in the survey. So they said behavior problems currently, behavior problems ever, in case anyone's like, why are y'all saying it that way? That's how they said it. But we did just stick with the ever on that so that we could show that effect. And you can see that that one affected all the way across. And that makes sense when we consider that depending on the nature of the behavior challenges, the caregiver may have difficulty or even be unable to find consistent childcare that's both safe and where people are trained to meet their child's needs, leading to having to either stop work or decrease hours to balance between caregivers. Also, because of the reimbursement challenges for many of our behavioral interventions, they may need to stay in that particular job if it happens that that one actually covers or partially covers a needed service. And of course, having difficulty covering expenses for those services.
So yes, these are the things that are affected for these families. Financial instability, work pressures, caregiving pressures, lack of support as a caregiver, and lack of financial support and resources. With more work-life, with more work-life stress, we have these outcome areas that can increase. Child maltreatment risk increases with financial or family instability because of increased stress on the family, including stress of finding the appropriate child care provider.
So the major areas that are affected and that we can target include practice, policy, and research. So when we think about practice implications, we're really talking about the medical care and the treatment sector. So how can healthcare providers adjust their personal practice to make sure they are providing care from that holistic model, considering not only how to treat the condition, but how to treat the individual and family based on their individual needs related to the need to work, their financial ability, a home environment, family dynamics, and much more. So for example, if a healthcare provider is caring for a child with asthma, the provider definitely needs to consider the treatment options for that asthma. So does the child need an inhaler? Do they need a second inhaler? Do they need equipment for at home to help manage their asthmatic episodes? But then they also have to consider, why is this child's asthma continuing to progress over time? Why am I not able to wean this child off of these 2 inhalers and this oral medication? Why is this child continuing to have exacerbations? So it's important that the healthcare provider take time to investigate and have curiosity behind the why for patients and for families that are being cared for, because those conditions may be worsening because maybe the child hasn't actually been taking their medications. Why? Well, was the family actually able to afford the medications? Was the family actually able to attend the appointments? Were they able to get to and from? What environment is that child living in? Because we know risk factors specifically for asthma include risk factors at home conditions like pet dander, roach excrement. So what environment is that child living in? Those are things that we have to consider as healthcare providers. As healthcare providers, we're trained to consider modifiable and non-modifiable risk factors, but essentially we need to consider what is actually able to be modified within that family and child situation. So in terms of policy changes, there's a need at the state level to improve salaries for early child care providers, which has been a theme, I think, throughout this conference, so that these providers can stay in the profession and are willing to take on children with significant health care needs, and they're able to immerse themselves in training that supports them in doing so. There's a need to relook at and broaden family leave policies and provide flexible work settings, especially for families who have children with those significant health needs. Because this expansion would provide flexibility for things like attending medical appointments, giving the parent or family time off for sick time with their child, giving them respite, and also vacation time. There's also a need to address funding for child care options to support children with these health needs, such as supporting and funding programs such as CRAWL, Child Care Ready for All, also the South Carolina Inclusion Collaborative, which provides training and support for professionals caring for children with disabilities, Beginnings SC, which supports professionals and families with resources for hard of hearing and deaf children, and there is also a need to support liaisons to child care resource and referrals, such as the Help Me Grow Foundation and CCR&R, which is the Child Care Resource and Referral System, which connects families to child care that meets that specific need of the family. In terms of research, we should continue to build upon data-driven information, including outcomes of support programs for children with significant healthcare needs, and how home stability and caregiver dynamics play into the severity and also the improvement of a child's condition. So based on the results of this study, parents and caregivers of children diagnosed with asthma, heart conditions, blood disorders, swallowing difficulty, or behavior problems ever struggled with issues across all 4 work-life stressors. The caregivers reported challenges related to having to stop work, cut work hours, pay for medical care, and avoid changing jobs to maintain current health insurance. This demonstrates that these health conditions in particular have a pervasive effect not only on the child's health, but also on the family and the family dynamic. These conditions impact every facet of that unit's life. If a family is managing a child with a significant condition, such as a heart defect, let's think about how that can affect the family. So if the child is in an early stage of diagnosis, then likely the child's going to be requiring extensive hospitalizations, maybe some surgeries, which could then take away time for that parent to be at work, requiring them to either cut hours or even stop working altogether. This change in employment then creates a shift in the household finances and can make it more difficult for that family to meet the basic needs of that family and its members. Once that child is discharged and at home, the child could then require multiple medications, may require long periods of rest or have limited activity, which may require closer supervision of that child and require a need for direct caregiver understanding of how to manage that child on the day-to-day. So then the question becomes, can the parent find a caregiver to properly care for this child? Because if not, the parent continues to have that burden of either limited or no employment. We also know that this can impact insurance and benefit coverage not only for the child but also for the family. So financial burden increases family stress. Managing children with significant healthcare needs increases stress. Increased stress in the family increases other risks, including child maltreatment, poor disease management, and potentially alterations or delays in the child's development. So it's this constant cycle of cause and effect. So these 2 health conditions, Down syndrome and behavioral problems currently, were statistically significant and predictive across a varied combination of 3 of the 4 work-life stressors, which makes sense because if you think about something like autism spectrum disorder, if that child with ASD has challenging behaviors, then this could make it difficult for parents to secure an appropriate child care facility or school that could properly understand and manage that child's behavior. So lack of placement could then impact the family's employment, which again leads down this negative cycle of impact. So as part of the protective factors framework, in order to strengthen families with a child with significant healthcare needs, we need to develop and promote tailored strategies for their circumstances. So we have framed some suggested strategies within the specific protective factors of parental resilience, social connections, concrete support in times of need, and supporting child development. So the question is, how do we build resilience in families and secure those concrete resources? So from big picture, there needs to be improved support and expansions of multiple policies such as FMLA. There also needs to be a review and improvement of workplace policies to include things such as split shifts so that parents could go to work but then trade off with other caregivers. The workplace could also provide flexible work options, which could include offering a remote or even partial remote options, or even flexibility of work hours or work days of the week. Having childcare in the workplace could also help the parent or caregiver feel more comfortable staying at work if their child is nearby, so that they could respond to any events or needs of their child more quickly, while still keeping the parent at work. Also, ensuring the workplace provides insurance and benefits for the caregiver and the family unit could help assure that financial stability and that access to care for that child. We also need to look more closely at ADA childcare requirements. So yes, childcare facilities are technically required to accept any child, but are they ready to do so? Are early childcare providers ready, safe, competent, and confident in accepting, caring for, and managing children with significant healthcare needs on the day-to-day? Of these protective factors, these strategies promote resilience and help secure those concrete resources. So we can also strengthen families through social connections using diagnosis-specific healthcare support systems. Meaning, if a child has something like sickle cell anemia, we can make sure that the child and family are connected to a support system such as the local sickle cell foundation. In doing so, they are connected with a local support group with children that have the same condition as them, and they have provision of specific education materials and sessions specific to their condition, so specific to something like sickle cell. Families can also be connected to community resources and services that support children with significant healthcare needs, including programs like CRAWL, Nurse-Family Partnership, Family Connections, and then other South Carolina-based community programs such as the South Carolina Inclusion Collaborative and Together for Families. So strategies specifically supporting healthy child development includes access to programs that help to promote healthy child development with consideration to a child's significant health care need. Programs such as SCIMA, which is South Carolina Healthy Infant Mental Health Association, and CRAWL support early child care providers to be able to reliably and competently manage children with health conditions in the child care setting. Programs such as SE First Steps, BabyNet, which is South Carolina's early intervention program to support developmental screenings and referrals for children under 3, and the Inclusion Collaborative, all of those programs support families and caregivers. Also having an interdisciplinary model, so having things like co-located services like dentistry, counseling, and a pediatric provider all in one location helps parents spend less time at different appointments. We're able to group those appointments, which allows ultimately that parent to have more time at work, which then increases financial stability, which then increases household stability, which ultimately creates that much more positive cause and effect cycle, which is going to benefit that child, that family unit, and that child's health condition.
So future analysis and research opportunities include studying the effects of targeted strategies and outcome and program evaluation, examining related factors such as home dynamics and community resources, and then, of course, consideration for comparison with post-pandemic once the data is collected and available from DHHS. So we would like to acknowledge our USC CRAWL team, and especially Heather Googe, who's with the USC College of Education and leads the South Carolina Inclusion Collaborative, and Naomi Barker, who is the CRAWL project coordinator and who actually initially started this data collection. Next is our references and our image credits, and then our contact information.
So we did want to take the opportunity to share our contact information for those who are based in South Carolina. How many here are based in South Carolina today? Okay, the majority, great. So CRAWL is, as has been kind of threaded in, a statewide program provided at no cost to childcare providers. We did happen to bring some brochures to help give you guys the information to take with you. It is targeted towards childcare settings, be it a facility or be it a home setting as well. So family childcare providers, which we know many families who have children with healthcare needs are often going to be using kind of that single childcare provider location as well. So we want to make sure that everyone's included. But we provide training for a variety of healthcare needs, including asthma, allergies or anaphylactic reactions, diabetes, seizures, congenital heart defects, and several others that are already developed. And we always say that if you identify a need and we don't have a module for it, do not hesitate to still contact us. We will develop that module and we will still do it with you. You'll just be our first that we do it for. But we want to make sure that every family who has a child with healthcare needs has the opportunity to get the child care they need, but also for the child care providers to feel confident and to feel competent and not feel like, you know, we agreed to take this child, but every day I'm scared. I hope nothing bad happens, right? We want to help build that sense of readiness. So our trainings are an online piece that you do individually that's set up in the SC Endeavor system that many of you are familiar with. And then we come in person wherever you are in the state, literally. We look forward to hitting the corners of the state. We have, yeah, we did go, yeah, we hit some corners already. But we come in person, and whatever the skills are that happen with that particular situation, whether we're given EpiPens, whether we're talking about inhalers, seizure medications, whatever it may be, we do that hands-on together. We talk, we troubleshoot. This can be done in preparation for a child who's coming, or it can be that you've already got children in your area. And we will always say that anaphylactic reactions is one that even if you don't have one now, you really do, you just don't know it yet. So that one's good for all. But if you are thinking, maybe there's a training interest here, the QR code works, so feel free to use that. The website certainly has more information. If you're already directly like, no, I know somebody, we want to do a certain one, please just go ahead and email. That would be a great way to get started, and our referral and outreach coordinator would reach out to you and get that set up. So on that note, thank you for hearing us. Now, we really want to have some discussion. We definitely want to hear any questions that you guys have about this analysis of kind of the needs and establishing what's happening for these families. But we also really want to hear what other things are happening, what other support services, whatever thoughts there are for other strategies to support these families. Please do use a mic so that everyone can hear. Come on down.
We need some music.
We do, yeah.
So my question was, I mean, we were whispering up there just trying to figure out who all you provide services to and stuff. So just thinking about like childcare support services and stuff, that would be super beneficial for all of them to be trained. But also I feel like this would be a great need for teachers too. And she's a nurse practitioner, so I was asking her lots of questions. But just she was saying like private schools aren't required necessarily to have a nurse at school. But I'm thinking too, like say there's a child in your classroom who has an asthma attack, like wouldn't you want to be trained in what to do? So do you guys provide services to schools? Is that something that falls within your realm?
Good question. So the philosophy of the South Carolina Child Care Inclusion Collaborative and its programs would be that if you need that resource, we want to work with you to provide that resource. Okay?
And
not a teacher. I was just wondering.
Well, tell your teacher friend.
Hello. I'm just curious as to what all is included under blood disorders.
Such a good question. So when working with big data, we have to give up some things. So I have designed some projects where I got to tweak every little variable. I knew exactly what was happening. And then you work with big data, and you're literally left with what they asked and how they asked it, which you're deciding, I want 29,000 subjects, so let me let me work with what we got. So I say that to say that it is not qualified. It is blood disorders. So it does leave opportunities for more detailed research, right? To say, let's hear more about sickle cell families, let's hear more about hemophilia, let's hear about the differences. But the bottom line is, at least we can say with the data, this is affecting these families in real ways, and we need to figure out the support systems rather than saying, well, yeah, they're just never gonna get where they need to go, right? Yeah, thank you, good question. Oh, yes, and Victoria wanted me to highlight that the module in crawl does focus specifically on sickle cell and hemophilia.
My question is, so as far as these daycares and like childcare facilities go, is it contingent on them reaching out to you guys to get trained, or can families who want to send their child there consult with the daycare to see if they're interested in getting this training, or how does that work?
That's such a good question. So in our original design, we were planning on leading off of the parent. That has been a recruitment challenge, really, finding the parents. But we are still highly open to, so we reach out to childcare facilities and say, hey, are you interested in any of these trainings? But we also still definitely welcome parents to say, here's my childcare facility, I'm looking to get them more training. And it really helps if the parent, of course, has already talked to the childcare facility, because we don't want to throw them off and have them like, why are you calling us? Are we in trouble? No, you're not in trouble. If the parent has already can facilitate that relationship with us. Yeah.
I work right down the road, and we housed in our building is this daycare called the Wonder Center. I don't know if you're familiar with it, but it's a daycare essentially for children that are medically complex and require like around-the-clock care by nurses. And there's a pretty long waiting list for it, from what I understand. But this helps these families in being able to work and like get respite in some way, but then also do their daily like activities while their child is under care that's qualified. And so, but I've had other families too, they're like, well, I want to send my child to daycare if the Wonder Center has a wait list, and not knowing where they could send their child. So this is really good to know that like there's other options and that you guys are a resource for these other facilities. So.
And I would say also to really refer them into the South Carolina Childcare Inclusion Collaborative as well, because they can really help support the facility in lots of other ways beyond the training that we provide for the specific need.
Can you say that name again?
And find. And they can also help find facilities. So
You said South Carolina Inclusion.
Childcare Inclusion Collaborative.
Gotcha. Thank you.
Yeah, thank you. And they also can help find, if a family's having a hard time finding a facility that fits, they can also help facilitate that piece. And that includes, by the way, so the child, anybody here happen to be from Child Care Resource and Referral? Okay, I was thinking they could say it better than I could. But they also, it does not just about healthcare needs, it's also if someone works shift work and they're having a hard time finding childcare, they will help, right? So any challenge that people are having finding childcare, that particular resource is very valuable. And our website is embedded in the Inclusion Collaborative's website. So you can back it up and go to the other pieces.
I work primarily with children who have a diagnosis of autism, and a lot of times I hear parents say that daycare said, we can't take your child, we just don't know how to handle them. So are those families as well that you all be able to like work with them to maybe reach out to a daycare to see like with some training, would you be willing to consider it?
So we would definitely want to work with that family, and we would also then partner with the South Carolina Child Care Inclusion Collaborative, because they have some resources. They have some one-on-one coaching that can happen with those childcare facilities as well. So absolutely reach out and let's get it figured out. It happens that as a consequence of other work, our recruitment coordination and recruitment and outreach, I'm like, what's the word? Coordinator. She's an autism spectrum disorder specialist in a lot of ways, and we have worked with her. She and I have done some of the same research looking at some of the risks specifically for those children. So we would absolutely want to hear from that need. Yeah. Mm-hmm. Anything else? Thank y'all so much for all the great questions. Anybody sitting there thinking, well, we have a great resource that we haven't shared? Okay, just making sure no secrets are left uncovered. Thank y'all so much. Have a good drive back wherever you're headed, or flight if you're from away.